Now we're going to move into today's topic, mommy makeovers. What is a mommy makeover in your mind? How do you define it?
Well, I think we have to look at what the mother is going through. Typically, they're in their mid-20s to 30s, even 40s. You have to look at what happened to the body, to the mother, after they had 1, 2, 3 children.
Okay.
They may have had C-sections, so there's often have had surgical procedures. Their skin has changed. They develop hyperpigmentation, melasma. They have frown lines from scolding their children. You can often, you can often count how many children they have based on the frown lines. So they're getting Botox. They're getting photofacials. They're getting fillers to try to regain that youthfulness.
Because after the kids, I mean, you say, I mean, they still want to look pretty.
Oh,
still want to be attractive.
Oh, definitely. We have patients who are in their 20s and 30s. They've had their children. They're done having the family. Now it's mommy's time. They've raised them. They've gone to the soccer games. And now, really, they've tried to gain what they used to have. And
they still want to look pretty.
Yes, definitely. They want to look pretty. They want to look sexy. They want to look good in and out of their clothing. Okay. And they go to the gym. They work out. They diet. They exercise. But some things become surgical, and that's where we step in.
Has this mommy makeover become something where they come in and say, I want a mommy makeover? I mean, is that word now being used out there?
It's a common term because that is referring to more of combination procedures. We get patients that come in just for breast augmentation, breast lift, tummy tucks, liposuction, but what we're seeing with mommy makeovers is that they still have children, they're raising them, and so they don't have a lot of downtime. So if we can do it safely at one time, then they're willing to take the time to do multiple procedures, and then they wake up and their breasts are lifted, they're fuller, they have a flat tummy, and that's what we're going after. And they're very happy.
You say you're changing people's lives.
We are
feel
changing,
that way?
Yes, we're changing people's lives. We're also changing them back to where they were, and that's the biggest issue. I have some photos here. This is very typical. You see a patient, she's pregnant.
We've all seen that.
She's had 3 children, and you think, what happens to the skin? What happens to the body? Well, this patient has problems with.
That's a good-looking stomach, though.
Well, admittedly, it is, and a lot of patients would even just like to get to this point.
Yeah.
But for her. And I repeat that for her, it bothered her. She was unhappy looking in a bathing suit. She wears clothing. Her tummy still sticks out. She complained of extra skin. She's had 3 children, so there was wrinkling in her skin. Now look at the side view. She was trying to wear a dress, and it didn't hug her so well. She was embarrassed with it sticking out. She said, "Oh, it really stuck out." She was embarrassed. When she sat down, she had wrinkled skin. You're sitting by the pool. Patients don't like that look. Now, Randy, look at this front view. Here she is sitting down. You can see the wrinkles down here that are very apparent because
they're slight, but they're there.
But they just lost the elasticity. Plus, they have some bulkiness, and so she has a lot of this fullness. Her tummy sticks out, plus the loose skin. So then I have a question. Should I treat that with liposuction? Should I treat that with tummy tuck? And in the olden days, with just liposuction alone, I would have been hesitant because I don't want to make things worse. And so if I just do liposuction and they have laxity in their skin, they may have more looseness. Could be.
Okay.
So then I used Smart Lipo.
Before and after I'm looking at, that's a sitting down shot.
That's a sitting down shot.
Very nice.
And as you can tell, you can see more muscular definition. The wrinkles are gone.
Looks like an athlete.
Well, she is quite athletic, in fact. She used to weigh 180 pounds. She lost 60 pounds trying to get back to this body. You saw her what her stretched out tummy looks like, and now picture her sitting at the side of the pool now. She's confident, she feels pretty, feels sexy, and she's able to wear this without any hesitation, whereas before she just wouldn't put on certain things.
So the side view is pretty dramatic. It just flattens it out.
It gives this shows the protrusion that she had before, and then that was due to the fat itself. And so now that the fat is removed, she's gotten a flatter appearing tummy.
Now in this other little lateral shot, I mean she looks, you got the hip bones showing now.
There's
you can almost see a
definition.
6-pack. There.
Yeah. In fact, a lot of males would like this tummy. Because it shows the raphe down the middle. It shows the outline of her 6-pack. Her obliques are very well sculpted now.
It is subtle, but you can see the difference.
Well, here's a fitness instructor. She came and she works out. She's at her pre-partum weight, and she has a issue with her breast. She has an issue with her abdomen. She does not like the way her belly button looks.
Okay, so that abdomen area, is that common, that skin like that?
It is very common. Most women have these signs of pregnancy. It's just that they don't show you. I mean, you don't see them in public. You don't see them
at the beach. Okay.
Exactly. They're covering this up, and that's why they come to our office. they want to have a better looking belly button. Even if they were able to wear something, show the midriff, they're unhappy. So if you, in the side view, Randy, you can see that her breasts are deflated. She lost volume, they're sagging. She also has an abdomen that protrudes. It's due to the wall laxity, but also has this loose skin that is not tight. For a fitness instructor, you want to show off a body. You want to be the example of what you're trying to achieve with your clients.
All right.
Okay, and then here's from an oblique view. You can see the shadowing. You can
Doesn't
see,
look like a fitness instructor.
well,
And that's
no,
just for
not yet.
babies. I mean, that's going to happen to a percentage of women that have babies. Is that right? Like 50, 60%?
Well, I think that a lot of patients can't control what their body's going to do after they lose the weight, after they shrink the skin, because a lot of that is genetics. We're able to give her fullness that she didn't have before. I know that the scars will fade with time, and so now with the breast lift, the nipples are in a better position. And look at that abdomen. Now it looks fit, it looks muscular, it's outlined. You can see the muscle definition, it's flat. Now she can wear low-rise pants, she can wear bikinis.
Do they act differently? I mean, you know, did they get a change in self-esteem? I mean, do you notice it?
Oh yeah, they notice it, their husbands notice it. It's just how they carry themselves now. And particularly for her, she's out there working their clients hard just to achieve, you know, a similar physique. I have several doctors who refer me, their patients, their families. I think it just kind of gives me a vote of confidence on their part.
Now, now, you say the big fear. There's a lot of people, and we are out of time, but there's a lot of women out there that are really afraid of the incisions or the scars. Well, and it keeps them from doing something. And that's a legitimate fear.
Sure it is. And we discussed that during the consultation.
What's your take on that?
Well, Randy, we go over this during the consultation. I have to ask them, what would you rather have? Would you rather have this body without scars or this shape with scars? And
that's a good point.
Invariably, they want to have the surgery.
So incisions or scars, should that be something that keep people from doing it?
I don't think it should limit.
Is that the #1 fear, by the way?
Yes.
It is?
Yes.
Okay.
But we have ways to modify the scars to reduce them with time. We have ways to do scar reduction even with some of our light-based systems that we have in the office.
Okay, time for one more.
Okay, let me show you this quickly. This patient here, she's struggled with her weight. She's still a large frame woman, but she complains that her breasts are sagging, she doesn't have the fullness, and she has an abdomen that
like a couple of kids, 3 kids in her place?
About 3.
How old is that woman?
She's about 45.
Okay.
And she has an abdomen that is just draping like an apron.
It is like a spare tire.
Yes, and so what we did with her is we were able to do a breast lift to give her more fullness. We used an augmentation for the roundness. She got some more cleavage. They're off her abdomen.
So even in the after, that's a plus-size woman, you say?
Yes, but they
looks very fit.
Well, it gives her a better shape. We've added the curves where she needs them, and we're able to give her a flatter tummy, less overhang. She's more comfortable with herself. She's more comfortable with her private life as well.
Do they ever tell people? I mean, some people aren't shy about it. They say, "Hey, I had a mommy makeover."
We have patients that can take credit, and I give them all the credit. They've gotten down to their weight, and I think the biggest compliment that they have is when people come up to her and they go, "You've had how many kids?" And it's
really?
Yes, and they can take credit for it, and I'm just happy to help them get there.